Dementia is often mistaken for normal aging, but it is a set of symptoms caused by brain disorders that affect memory, thinking, behavior, and daily life. Early diagnosis is important because it can significantly improve care and quality of life. The challenge is that early symptoms feel ordinary, forgetting names or misplacing items. What matters is not the mistake itself, but how often it happens and how much it disrupts everyday functioning. Number 10. Memory changes that disrupt daily life. Occasional forgetfulness is normal. Everyone forgets appointments, struggles to recall names, or walks into a room and forgets why. With dementia, however, memory loss becomes persistent and disruptive. Individuals may repeatedly forget recently learned information, ask the same questions over and over, or rely heavily on memory aids and family members for tasks they once handled independently. This type of memory impairment goes beyond inconvenience. It interferes with work responsibilities, household management, and social relationships. Over time, the person may lose confidence, withdraw from activities, or feel frustrated by their inability to keep track of information that once came easily. Number 9. Difficulty performing familiar tasks. Daily routines anchor our lives. Cooking meals, dressing, driving to familiar locations, or managing personal hygiene are tasks we perform almost automatically. In early dementia, these familiar activities can suddenly become confusing. Someone may forget the steps in a recipe they have prepared for years, or struggle to complete a basic grooming routine. Unlike occasional distraction or multitasking errors, dementia-related difficulties persist even in calm, familiar settings. The person may abandon tasks halfway through or require increasing assistance, often without understanding why the task has become difficult. Number 8. Language and communication problems. Language difficulties are another early indicator that often goes unnoticed. People living with dementia may struggle to find common words, repeat phrases, or substitute incorrect terms that disrupt the flow of conversation. They may lose track of what they are saying or have trouble following discussions, especially in group settings. While everyone experiences tip-of-the-tongue moments, dementia-related language changes are more frequent and more disruptive. Conversations become frustrating for both the speaker and the listener, leading many individuals to withdraw socially to avoid embarrassment or confusion. Number 7. Disorientation in time and place. Losing track of dates or temporarily forgetting where you are is something most people experience occasionally. Dementia-related disorientation, however, is more severe and persistent. Individuals may forget what day, month, or even year it is, or become confused about their location, even in familiar environments. In some cases, people may get lost on their own street or be unable to retrace their steps home. This disorientation can create fear, anxiety, and safety risks, particularly for those who live alone or remain active outside the home. Number 6. Changes in judgment and decision-making. Judgment is the brain's ability to weigh risks, predict consequences, and make sensible choices in everyday life. In the early stages of dementia, this ability often weakens quietly, making the changes easy to overlook at first. A person may begin making decisions that seem unusually careless or out of character, especially with money, health, or personal safety. They might give money to strangers, fall for scams they would once have recognized, or ignore medical symptoms that clearly require attention. Some may dress inappropriately for the weather, walk into dangerous situations without hesitation, or fail to recognize hazards around them. These behaviors are not isolated mistakes or moments of poor judgment. They reflect deeper changes in the brain regions responsible for reasoning, impulse control, and risk assessment. As dementia progresses, the individual's ability to evaluate situations realistically continues to decline, increasing their vulnerability and dependence on others. Number 5. Problems with abstract thinking. Abstract thinking allows people to understand ideas that are not physically visible, such as numbers, time, patterns, and cause and effect relationships. Dementia often disrupts this ability, making tasks that once felt routine suddenly confusing or overwhelming. Managing finances, balancing a checkbook, calculating change, or understanding bills can become increasingly difficult. Numbers may no longer make sense, and even simple calculations can feel mentally exhausting. This decline often shows up during planning-based activities, such as budgeting, scheduling appointments, or following multi-step instructions. Because these challenges can develop gradually, they are frequently dismissed as stress, distraction, or lack of interest. Unfortunately, this misinterpretation can delay medical evaluation, allowing cognitive decline to progress unnoticed until daily functioning is significantly affected. Number 4. Misplacing items in unusual places. Misplacing belongings happens to everyone, but dementia changes both the frequency and the pattern of this behavior. Instead of losing items in logical locations, individuals may place everyday objects in completely inappropriate places. Keys in the freezer, a phone inside a shoe, or food items in drawers meant for clothing. What makes this symptom particularly concerning is the inability to retrace steps or recall how the item ended up there. Over time, this confusion can trigger suspicion or paranoia. A person may genuinely believe others are stealing from them, even when no theft has occurred. These accusations are not intentional or malicious. They stem from memory gaps the brain tries to fill with explanations. This symptom can strain family relationships and create emotional distress for both the individual and those caring for them. Number 3. Changes in mood, personality, and behavior. Dementia affects more than memory. It can alter the emotional and behavioral core of a person. Individuals may experience sudden shifts in mood, becoming anxious, fearful, suspicious, or irritable without an obvious cause. Someone who was once calm and patient may become easily frustrated, while a previously social and outgoing person may withdraw from conversations and gatherings. These changes can appear rapidly and feel deeply unsettling to family members who may feel as though their loved one's personality is slowly slipping away. In many cases, the person with dementia is also aware that something feels off, which can increase anxiety, defensiveness, or emotional outbursts. These behavioral changes are not intentional. They reflect damage to brain regions that regulate emotions, impulse control, and social behavior. Number 2. Loss of initiative and motivation. A noticeable decline in motivation is another early but often misunderstood sign of dementia. People may lose interest in hobbies, social activities, or responsibilities they once enjoyed and valued. This is not simple tiredness or a passing phase. The withdrawal is persistent and tends to worsen over time. Individuals may sit for long periods without engaging in activities, avoid conversations, or abandon routines entirely. Even tasks they are still physically capable of completing may require repeated prompting or encouragement. This loss of initiative is frequently mistaken for depression or laziness, but it stems from changes in the brain's ability to initiate action and sustain focus. As a result, the person may appear emotionally distant or disengaged, even though the underlying issue is neurological rather than emotional. Number 1. Difficulty understanding visual and spatial information. Visual and spatial difficulties in dementia are caused not by the eyes themselves, but by the brain's impaired ability to process what the eyes see. Individuals may struggle with depth perception, judging distances, recognizing faces, or navigating familiar spaces. Everyday tasks such as parking a car, setting a table, pouring liquids, or finding their way around a familiar room can suddenly become confusing. Some may bump into objects, misjudge steps, or feel disoriented in places they have known for years. Because these symptoms closely resemble common vision problems, they are often misattributed to aging eyes. However, when glasses or eye treatments do not resolve the issue, it may indicate a deeper neurological cause. Consulting both a medical professional and an eye specialist is essential to determine whether dementia is contributing to these visual spatial challenges. If this video helped you understand the early warning signs of dementia more clearly, share it with someone who might need it. Awareness can make a real difference. And if you want more clear, honest explanations about health, the brain, and the science behind everyday symptoms, make sure you like and subscribe, because staying informed is one of the most powerful tools we have.